So, hello, today we're presenting about Bowen's family systems theory. I am Rachel Mihalos, and I'll be presenting with my partner, Alan Masoke. So we'll start off by talking about Dr. Murray Bowen, who was the founder of this theory. He was born and raised in Tennessee and was the oldest of 5 children. He was born in 1913. He earned his MD from the Medical School of the University of Tennessee in Memphis in 1937. And from 1941 to 1946, he served in the Army during World War II. And this was an important time in his life because observing the trauma that he saw in soldiers caused him to shift his focus from surgery to psychiatry. And so after the war, instead of going to take an internship at the Mayo Clinic, which was his plan, he instead went and became a fellow at the Menninger Foundation in Topeka, Kansas from 1946 to 1954. So initially he trained in this Freudian psychoanalytic theory. However, he began to depart from this when he saw that individuals' difficulties went beyond their unresolved problems with their psyche and were instead embedded in their family system. So from 1954 to 1959, he embarked on a 5-year research project at the National Institute of Mental Health. So in this study, the individuals were adult patients with schizophrenia, and they moved into an inpatient psychiatric unit. Initially, their mothers moved in as well, and eventually the whole family moved into the unit. 11 families in all of adult patients with schizophrenia lived on this unit for up to 3 years. And they also were able to work with 7 additional families on an outpatient basis. So for the patients who were inpatient, the researchers were able to complete meticulous observations around the clock, 24/7, of the interactions between the family members and interactions with the staff members on the unit. So this was pretty revolutionary at the time, as this was a pretty significant departure from the Freudian psychoanalytic approach to family therapy. And the work that he did in this study led to the development of this theory. So initially his idea was that the child and the mother developed an intense emotional bond, which was like an evolutionary characteristic of mammals and was necessary for survival. So in order to survive in utero and after birth, the baby and the mother had to be closely bonded. His speculation was that when this bond continued into adulthood, that these adults were having difficulty achieving autonomy because of the intensity of this connection. He saw that when extrapolating this to the family, he believed that the levels of anxiety which family members demonstrated were similar to the way that animals might become anxious to perceived threats when they are operating in a herd or a pack. So his theory, when applied to human behavior, was that the exaggerated responses to the perceived threats to the family's harmony were what they were seeing causing symptoms. Because of this ability to provide detailed observations about the family, Bowen eventually revised his hypothesis that the intensity of the mother-child relationship actually extended beyond the dyad and involved the whole family. And he viewed the family as an interlocking system in which all of the members impacted each other. And so we can see with the 4 members each holding a piece of the puzzle, this is kind of a representation of the family unit. So a direct quote from Bowen was that he stated that first the schizophrenia is in the patient and now it is in the mother. And the area of the problem shifted in a way to suggest first the problem is between the mother and the patient, and now it is between the mother and the rest of the family. So he recognized how the symptoms could move and shift from the identified patient, the patient with schizophrenia, to the mother and then the rest of the family. So according to his theory, families function as an emotional unit in which each member has specific roles and must follow certain rules. And these may not necessarily be explicitly stated, but they are basically the rules and the roles that people fall into as the family develops. All family members impact each other through their behaviors and the patterns of being. For instance, if there is if the husband or the father in the relationship is going through a depressive episode, the wife or the mother might have to step up and overfunction in order to maintain the stability of the family. And so while this can help maintain the stability in the short time, and the equilibrium in the family will shift a bit, it becomes more of a problem long term because it's harder for the mother to function at this high level for a long period of time. And so over time, what you might see is that this pattern becomes dysfunctional, and the mother might start to have more problems with other family members. It is important to recognize that all families have levels of interdependence between members. However, in some families, this can be a positive thing where people are mutually supportive and respectful. However, in others, it might cause dysfunction. And sometimes you might see a little bit of both depending on the relationships. Bowen also believed that there will always be one family member who will absorb the bulk of the emotions in the family. So because this person adjusts their emotions and their behaviors to diffuse the tensions of others, this is the person who is most susceptible to developing depression, addictions, and physical and psychiatric illnesses. When this person becomes symptomatic, they become the identified patient, and the family then shifts their attention to this family. This person may start to bear the blame for the stress in the family and can become the scapegoat. But this is why focusing on Bowen's model can be really helpful in assessing the family, because it can identify the patterns of behavior and the interactions among family members to reveal how the symptomology of the identified patient developed and what can be done to try to adjust that and try to come up with a solution. So the genogram is a really important tool in this theory, and it's a graphic depiction of the family functioning over several generations. So it shows some of what we've been talking about. There are standard symbols to make it easy to understand. Men are always represented as squares, women are represented as circles. In a relationship, the man is always listed on the left. And at first glance, this might look very simple, but unlike the typical family trees that we've all made in grade school, this doesn't just show ancestry and offspring, but it goes on to describe relationships and medical and psychiatric illnesses. So when Bowen would undergo his creation of a genogram, it took significant work and exploration with the clients in order to interview each member of the family to gain this information. And he would explore not just, like I said, offspring and birth and death, but also relationships and how the members function with one another. So the genogram then serves as a visual depiction of this, and it can also include pivotal moments such as marriage dates, divorce dates, the birth of a child, and important patterns can be identified, and this can be used as an ongoing tool in therapy. This is important for the clinician in working with the family, but also important for the patient so that they can explore how their behaviors and symptoms have developed and lead them along in their journey of treatment. So the goal is to go back at least 3 generations from the person of interest or the identified patient. And as I said, we have a lot of different symbols, and there are books full of different symbols that represent many, many different parts of the family with regards to sexuality, relationships. Just some key points here. Someone who's deceased is marked with an X. 2 perpendicular lines to the marital line are indicative of divorce. 1 line is indicative of separation, and a dotted line between a man and a woman, in this instance, in a relationship, is indicative of not being married, but rather being together. And then the lines for stillbirth, miscarriage, and abortion are shorter than the lines for living children. So what this also helps to see is that all human relationships are driven by these counterbalancing forces of individuality and togetherness, because we are naturally driven towards interdependence and companionship. And these forces will drive us to get closer to or move away from others. For instance, in this genogram, you see the triple line bonding the male's 14-year-old son to the mother, and that shows a fusion, a very, very close, some might say unhealthy emotional bond. And again, this is sort of how it shows us in a visual form the relationships between the family members. So this helps lead us into the concept of self-differentiation, which is trying to reconcile those forces. And this is important because being able to self-identify and self-differentiate is predictive of the health of future relationships with others, as well as emotion regulation. And evidence demonstrates that women who have a greater degree of self-differentiation had a higher level of marital satisfaction. Alan will talk some more about the self-differentiation, but it's important to note that Bowen also believes it's important that clinicians who are working in this model take a look at their own family's genogram and try to examine their own beliefs and level of self-differentiation so that they can make sure that they're not letting their beliefs and patterns of behavior interfere with the work that they're doing with their clients. So I'm going to turn it over to Alan so that he can talk about Bowen's 8 concepts.
So the main concept with the 8 concepts is the differentiation of self. And this is the degree to which self is you're able to withstand stress or non-influenced by the relationship. An example that I could use is when a husband and a wife are together and that energy is equal in an equal state where they balance each other out. So in that state, they have an equilibrium, but if they bring a baby into the equation, then they divert some of that energy to the baby and that could throw off the equation. So there is a scale that is used to identify or to see where somebody stands on the scale. And a person who is having symptoms will have a 1, the symptom bearer. And at 60, that's where most individuals are, and they will be throughout life, depending on their coping skills. So if the dad was not able to cope with the situation, or if they had the baby and they were not able to cope with the situation, that means they could be more dependent and that could throw off the equation, or they could be less dependent on the situation or on the relationship, and they could withstand the impact or the situation they're going through of having a new baby. And they could be, so the more they are able to withstand it, that will be self-differentiation. The next one is the triangle. And the triangle is basically what Bowen used to identify the relationships that happen within families. And he went ahead to say, so this is believed that dyads are the most basic relationship. However, could be the most unstable when conflict arises. A triangle in Bowen's theory is a 3-person relationship and is considered the foundation for the larger family system and overall functioning. Many triangles exist in families as each combination of 3 members forms a known triangle. These interlocking triangles impact the overall functioning of the family and contribute to their complex interactions. In situations where the dyad is at odds with each other, they often involve a 3rd member to balance it out, and which leads to a triangulation where basically one person is absorbing all the energy, stress, and that could be a bad thing. It's a bad thing for the person who is absorbing all this stress, which could be a child. So it goes on to say, so the 3rd person often absorbs the stress from the dad's strained relationship. This may occur when a couple has a strained relationship and the child becomes the 3rd member of the triangle. The children in this role learn to keep their needs and wants to themselves. We can see how a child in this role would develop self-differentiation, although Bowen avoided identifying mental illnesses. We can see how triangles and triangulation specifically lead to the development of mental illnesses in children and adults. So these kids grow up to have a hard time coping with situations because they have not mastered self-differentiation. So the next one is the nuclear family emotional system, and this describes the range of relationship patterns that problems in a family, and there are 4 patterns of this problem. So could be the marital conflict where tensions increase and then one partner projects the anxiety onto the other partner. Next one is the dysfunction in one spouse. So they can lead to pressuring another spouse who happens to be a subordinate, and that could lead to higher to levels of anxiety. The 3rd one is impairment of one of the children, and that's where the parents focus all their anxieties to the child and that could limit their differentiation of self. The emotion distance is where family members may distance themselves from tension and to reduce the tensions of emotions. family projection process, parents are transmitting emotional problems onto the children. And this basically is where they feel the child could be having a problem or there's a fear, and they kind of, in their mind, they confirm it by what they see in their behavior. So what the parent is treating as if the child is having, the child is ignoring they're basically ignoring their negative and positive traits by confirming that person maybe has, let's say, ADHD, and by how the child acts, and they ignore the other part of it. And multi-generation transmission process is where you compare one generation to the generation that was like there 10 generations ago, and this will show major differences in self-differentiation. And you can see this in their lifestyles. They're very different. There's a big difference. And another example that could be alcoholism, where one person in one generation had it and the other person did not have it. So there's different lifestyles. The next one is the sibling position. The sibling position is all about different qualities that people in the different, so let's say a firstborn and the lastborn could have different qualities depending on their hierarchy in their family. So they have different qualities. The next one is societal emotional process, which is most times also added to the cultural forces, which can influence behavior and can lead to progressive or regressive in a society. And this can help determine how well society can cope with challenges. So, and that determines, so the next one I can go to the application of theory, and that's the genogram. The genogram has been applied to assess and to treat families. And basically the therapist will use that to trace health issues or any type of conditions that were there before in other generations. So the next one will be emotional connecting with the families emotionally, and this is done by the therapist while avoiding to interrupt or to tell families what's wrong with them to fix certain issues that's going on in their lives. So the next one is moving towards differentiation of self and away from blaming or emotional reactivity. And this can be seen, let's say, in a substance abuse program or treatment where individuals get a sense of who they are by identifying their strength and minimizing the weaknesses. The next one is accepting personal responsibilities and change. Accepting personal responsibilities and change, that would be including, so basically what it is like the goal is to facilitate if the family members accept their responsibilities and move towards making corrections or changes, positive changes where negative changes or negative behavior is. So this type of therapy is applied with counseling couples, and also with families. And in counseling, it's used to identify unhealthy patterns or how each partner relates to another. Next one is determining the disposition in an emergency psych eval. So when families show up with patients or their relatives to, like, let's say a program, they would wish their family members to be admitted. But so as a clinician, they'll use the theory to determine if this patient really needs to be admitted or they need to make a referral to somebody else or another professional who can help the patient better. And so the family is wanting the patient to be admitted does not necessarily translate to being the best option. While we can see patients who have more supportive systems are less likely to come to the ER. So the benefits of treatment, actually, so evaluating relationships among healthcare professionals. That was a study that was done to see how this theory would be beneficial to nurses in an intensive care unit. So what it was Bowen'S theory was applied to international relationships, interpersonal relationships among staff on the critical unit to manage anxiety. The company is providing care on an intensive unit. Assessment of interpersonal relationships through the lens of Bowen'S theory provides information about this, the social processes that impact staff well-being, quality of evidence, supports the application of Bowen'S theory in the setting, and may improve the staff retention, well-being, patient patient satisfaction and prevent compassion fatigue. So that's how effective it was, and they can apply it in different settings. So the benefits of this treatment is improving communication within the family, addressing multi-generational problems. This could be, in the past, they could have had maybe alcohol problems and they can adapt better. Well, if this are identified in the generations that were there before them. So this is something that could be passed on. Transitioning through a divorce would include helping out children who could get caught up in the divorce, helping families and individuals deal with trauma, which sometimes they may not even be aware of, but tracing back what could have happened in the past and how it affects the present. So we all know this theory is used to treat addiction, schizophrenia, bipolar, anxiety, and personal issues, and also eating disorders. So learning about the human emotions, which could affect the physiology of a person, could be applied in all different settings. So once it's done, we can come up with creative ways to treat patients, because now we know how the emotions or human emotions could affect this person. And that could be really something that still needs more work, but it's very helpful in that way. And this could also help you out at work. So this theory has also limitations, and part of it it lacks empirical evidence to see how impactful or it can be, even though most studies have proved that it's really helpful, but it lacks more crucial evidence to really prove this is how effective it is. The unwavering neutrality is where the therapist is quiet at all times, no matter what the patient portrays or says to them, just so they don't interrupt or choose a side. But this could be a signal of approving whatever behavior or whatever behavior or condition they present to them. And this could also be dangerous. Exposure to painful situations, which could lead to anxiety. And part of this theory is being truthful about whatever happened in the past to come up with a solution. But this could open up new wounds that were buried back in the generations or something, and this could start up different health problems, including anxiety. So this theory is also done using a family approach as a unit, but so it does not give a lot of credit to privacy, and that's part of the disadvantages of it. So there's not really that part of individual therapy if you're seeking part of it, because it's as a unit. So this another disadvantage we can see is it's not as effective if somebody does not have a high education level, which can affect how they express themselves or how they digest that information to really know exactly what the therapist is talking about. Thank you.
Thank you very much.